Nasha, welcome.
Thank you, Shashi. Good to be here. Thank you.
So we are so happy that we can ultimately see you, and that you accepted this to attend for this session in India's first low-carb conference. And of course, we this is basically, I know that you have a big story behind you. So, such a brilliant story, and we will hear more about this in subsequent sessions. For this, we have invited more of you for to understand what is this metabolic health day, which you have, we had it in October. So before that, so I'm Shashikant Iyengar. So you can call me Shashi in short. Metabolic health practitioner in India, accredited by SMHP. And this is Anup Singh. So Anup, you can introduce yourself.
Yeah, just a moment.
You as well.
I'm Anup, and I'm founder of DLife.in, which has now grown up to be the largest and the fastest growing low carb community in India. It's an award-winning platform, and we are now focusing on creating, an army of low carb coaches.
Yes.
So that's in short.
Oof, that's beautiful.
Welcome to India.
Very, very humble. So we are type 2 diabetics in remission. I'm for 8 years, and he's more than 12 years. He's into 13th year. Pillless, no pills.
Wow, you guys, amazing, wonderful to be here with all of you.
And his army of metabolic health coaches, which is creating, are having diverse successes. In fact, in our group, we are having one success even with cancer case. So we'll talk more about it later on. So it is very diverse: diabetes, blood pressure, obesity, weight loss, PCOS, mental health. I personally had a success with bipolar case, and plus other cases also. So before proceeding ahead, I think we have talked too much into it. I'll give a proper introduction of Nasha Winters. So Dr. Nasha Winters' first experience with cancer was at the age of 19. She was diagnosed with stage 4 ovarian cancer and given only few months to live. The metabolic approach to cancer stemmed from her early decades of personal and professional experience in the field of integrated oncology. So Dr. Nasha is a licensed naturopathic doctor, ND, and is a fellow of the American Board of Naturopathic Oncology. She is the global healthcare authority in integrative cancer research. Dr. Nasha is the most sought after speaker and consults with physicians worldwide. Welcome, Nasha.
Oh my gosh, what an absolute honor to be here with all of you. I feel, as I was telling Pasha in the breakout room before, that this time it's now, and I'm so proud that you are leading the charge of this and that I get to play a tiny role in it. So thank you for having me.
Your tiny role is going to become very big because we have a live case of cancer in remission. So it's big. And this 30-minute may not do justice to that, but I can assure you that your session is really fascinating, is going to be. So please tell us more about yourself and also the unique story of battling cancer.
Sure. So as you noted, cancer was my foray into metabolic health space for, at this point, 32 years. As of October 21st of this year, I have been 32 years past my expiration date. So I get to be here with all of you. And metabolic health, this arena, continues to inform me, continues to be my teacher, and continues to humble me every day at the things I've gotten to learn. And so I've moved from the role of being a patient to a student to a doctor to a teacher and a consultant and an ongoing life learner and co-creator, which is what we are all getting to do here together. And so for me, in this community, I heard a little bit at the end of the last session that you've already gotten to hear from one of my colleagues, Dr. Eric Westman. Brilliant. And I'm sure many of you have already talked about this, but I think when people think about metabolic health, they immediately, they might think about obesity. They might think about diabetes. In standard of care, we define it as sort of these 5 metrics of like hip to waist ratio and blood pressure, lipids, those kind of, insulin, or just not even insulin. They don't even look at that typically, glucose, general stamina, and sort of muscle mass. And yet it goes so far beyond that. In fact, at its core, at its very foundation, is that metabolic health is the foundation for all life and all conditions. And so at its very core is that little organelle within our cells, the mitochondria. So I'm sure you've had a lot of mitochondriacs specialists in this arena speak to this and the biochemistry of this. But how I like to explain it to my patients and to my colleagues is that our mitochondria are like these little receivers of information. That's all, right? And they're sensing the environment in, on, and around us. And that's in all things. That's beyond just food, which is what we're heavily discussing here, but it's also water, air, light, energy, emotions, toxins, medications, but also, good things too. Our cells take in the good information as well. And once those organelles take in that information, they translate it and then send information and signaling back out into the body. And that is the driving force behind the creation of health or disease. And so though my area of expertise happens to be in cancer, because cancer and I became very close early on in life, I have found over my 3+ decades career that this is the same conversation I could be having if I was a diabetes specialist or a PCOS specialist or an autism specialist or an Alzheimer's specialist or a bipolar specialist. And to your point, I wish we'd kind of stop siloing out the titles of the disease and just call it what it is. This is a metabolic condition. And so it's an honor to hear this echoed back in this room and beyond, that I think we're finally getting to that point to recognize the root of all the major illnesses that bother us today, that take our lives today, that extreme burden on healthcare costs today are all metabolic in nature.
Very interesting. Very interesting. Yeah, no.
Yeah, Dr. Nasha, please tell us more about this Metabolic Health Day that you came up with, and what are all the activities that you've done on that day? And that's the beginning.
Love it. Well, this summer I was on my whirlwind speaking tour. I was in 6 countries over 6 weeks with 9 lectures. And I've been doing this kind of regimen. I speak anywhere from 30 to 40 conferences a year all over the world, but something changed this year. Because I go around beating the drum of metabolic health, mitochondrial health, oncology, cancer prevention, the core that all of our diseases bothering us today is metabolic. But I felt like for decades, it landed on deaf ears, or I was just preaching to a very small choir. But something changed this summer, you guys. Something changed where every single conference I went to, all over the world, Switzerland, UK, Maldives, all over the United States, Canada, Mexico, every single place that I went, the discussion had some theme of metabolic health. And it just like hit me in the forehead. It was like, wait a minute, finally, we're saying and hearing the same thing. And so when I came back at the end of that trip, frankly, fired up and inspired and feeling hopeful that we're making some headway, my team and I at the Metabolic Terrain Institute of Health started to figure out, hey, we've got pizza day and margarita day and breast cancer awareness months. And we thought surely there's a metabolic health day. So we started searching because we thought, let's do some cool events around that. And as we started looking, we realized this doesn't exist. It's incredible to me that with this being our true pandemic globally, that this day or month or whatever does not exist. And so our team, 6 weeks before the 10th of October, so the first inaugural Metabolic Health Day was 10/10/23, just shy of a couple weeks ago. Within 6 weeks, we decided to go online, register this day. We're going through the legal processes to make it official. We decided to reach out to as many people that we know in this space and help them help us and create a movement. And in a matter of weeks, you guys, we brought in over 70 foundations, family foundations, corporations, individuals, medical practices, researchers, products, companies that are all very, very, very much in the metabolic space, in all of those different silos, from mental health to diabetes to obesity to cancer to just all the things. And we managed to pull off the inaugural International Metabolic Health Day on 10/10, which our numbers have shown us that we reached over 6.4 million people. So I am pretty darn proud of what started as 0 as of the middle of August, end of August, ended up reaching 6.4 million people. So with that, what that's done for our community, the Metabolic Terrain Institute of Health in general, and the partners that joined us, including Metabolic India, you guys coming in on this process as well, being one of our founders, founding voices of this, is we are already starting to make plans for next year's 10/10. And so exactly what you're doing here is one of the things we want to see. We want to see regional conversations, and people like Low Carb USA have been doing that. Another one of our dear, dear colleagues, and the Metabolic Health Practitioners program they've created that Shashi is part of. And of course, Noakes Institute, like all of these foundations, everybody's doing it, but we've all kind of been siloed, doing them on little tiny islands by ourselves. I feel like thanks to the globalization of social media and whatnot, that we've all completely linked arms. And my goal is next year, I don't want to hit 6.4 million. I want to hit 60 million. And so that's the goal I've put out and put charge to all of the other 70 foundations. And we hope we double that number of people involved by next year. So those are the things we have, and we want to start having some meetings with those 70 different people that were involved to brainstorm on how we can really start to make this a meaningful day, if not month, of awareness every single year. And not just awareness, but action oriented.
Very
huge.
interesting.
That's
In fact,
huge.
your posters and flyers were all very interesting, and that was shared by your staff or your colleagues, and we had been floating it in social media daily, whenever they send. So whether it is Twitter X, whether it is Instagram, whether it is Facebook, or it is in LinkedIn. So we have been sharing it, even in threads, we have been sharing it on daily basis.
Yes, thank you. And we hope that it continues. We've continued even these 2 weeks out. We are still getting massive reach. People are signing up for more information. We're really looking at how do we capture this and how do we take advantage of the energy and momentum. That's why I love that this timing of your event was already seeded when this happened. So it's like we're keeping that ripple going thanks to you and people like Doug Reynolds and people like the Noakes Foundation and everybody else moving this out, that we just keep this tide moving.
And that is why we did not call it as a low-carb conference. We called it as a metabolic health conference. So
Exactly.
this is the change which we decided, instead of calling it, though it is a low-carb conference, however, the name is Metabolic Health Conference. So that is the very metamorphosis which we had. So it's really nice. And what do you know about India? I'm very curious.
Well, I love that this question. In fact, in the breakout room, Pasha and I got to speak a little bit. My first time, so I'd had a long-term dream of going to India. My first time to India was in 1994. A few years into my diagnosis. India was on my bucket list to see before I died. There was just some deep love affair that I had with your country before I ever put my first foot, forward on your land. And at that time I was traveling in the north. I spent some time up near Delhi and Agra and all sort of the touristy environments, spent some time in Ladakh and northern India, trekked in that region. I will tell you from the train rides and the conversations I had, because of my own cancer diagnosis, I was asking people. I was also there seeking other providers in sort of integrative oncology. And in 1994, cancer was virtually not an issue. I didn't find anybody with cancer. I didn't find any experts in cancer. No one seemed to know anybody in their families with cancer. I had a few people talking about, they would talk about, I have a touch of the sugars on some of the train rides I had. So there were some little tiny murmurings about blood sugar issues, diabetes, but I didn't see the obesity. I didn't see any of those things. This is in 1994. Fast forward, after I finished medical school and my boards, I was pretty burned out and decided to go and spend some time because I'd been studying Ayurveda for about 13 years. And I wanted to go and mentor and intern with some of my teachers in India. So I spent 4 months in southern India in Kerala and I was telling Pasha, I went up into the Nilgiri Hill region as well and spent a large chunk of my time in that part. And the conversations were starting to change. I was on a 36-hour train ride from Mumbai all the way to the south tip of India. And this family that I shared my car with, she was reading because we started talking, and she was dealing with diabetes. And we were talking about my story with cancer. At that point, I was, almost 12 years out from my diagnosis and doing really well. And we had this beautiful bond with this family. And she was talking to me about her diabetes. She actually gave me a book. I tried to find it this morning, but I think it's still in my storage unit. And it was like a really old school Ayurvedic book about diabetes. And she was even telling me it was virtually unheard of. No one in her family had ever had it. And now she's telling me this, we're drinking chai on the train, right? Which is, at that time, when I was there in 1994, it was chai with a little bit of milk and virtually no sugar. When I came back 10 years later, it was literally like having a glass of sugar milk with a little bit of tea. And I thought, has my palate changed that much? Because by that time, I was a good decade into low carb lifestyle for my own healing, that I thought perhaps my palate had changed. And I was watching her just drink cup after cup after cup of this. And my brain was like, how is that not connecting? Flash forward again in 2013. This breaks my heart every time I think about it, but I had an entire family from Pune come to me online, a virtual interaction. They came to me originally because mom, the mother, and why they came to me is because of my history with ovarian cancer. Their mother was diagnosed with terminal ovarian cancer. When I started running labs on the mother, her vitamin D levels were 6. You can't be metabolically healthy at a level of that. Her insulin levels in US ranges were in the 30s. Her hemoglobin A1C was 10.2. Her glucose levels were in the hundreds, which I don't know what that equates to in European terms, but she was so extremely diabetic and had no idea. Right. And one of the key drivers of ovarian cancer is insulin. Insulin growth factor is one of the key drivers. And then to talk with the husband and the 2 daughters that came in on the visit, they were like, we're here to help whatever we can. They'd read, at that point, my book hadn't even been out. Right. So they didn't know anything about me. So we started on that process and got her completely into remission, completely in a matter of months. But the change was difficult because here's this white woman from America telling them that the way that they've been eating for the past 10,000 years was not working for them anymore. And I was so relieved that I heard everyone talking before I came in. I'm like, oh, because it's very difficult when you sit there and explain the food of today is not the food of yesterday. The activity of today is not the activity of yesterday. The environment of today is not the activity or the environment of yesterday or generations previous. And so it's not our food's fault that it's a hot mess now, but it is a hot mess. And as such, it creates a hot mess in us. And so that was one of the big stories. And a few years later, when my book came out, that family read my book, came back as a whole because mom was doing really well, but now dad has hepatic carcinoma, very aggressive liver cancer. He was given months to live. We managed to keep him around for several more years beyond that. And then the other daughter, one of the young daughters, not quite 30, diagnosed with breast cancer. And the other daughter, younger daughter, had polycystic ovarian syndrome, which was the precursor to ovarian cancer. And so I'm looking at this whole entire family unit that's so sick. And luckily at that time, there were very few, if any, resources in how to do a carb restricted diet in an Indian population. And so I had, from my years of Ayurveda study, from my understanding of carbohydrate restriction, I had a pretty good idea of how to start to manipulate the diet. Not an easy venture, guys. when the whole entire culture is based on pulses, right? And so for that, I was able to get the entire family, all of which were diabetic, all of which their vitamin D levels were low, all of which they had all the patterns. The kids, the daughters were getting more and more obese, all the different things happening here. So that's been my journey with India over 20 plus years of watching it being virtually unheard of, to a little bit of talk about diabetes, to an entire family riddled with cancer and diabetes together. And so it became a passion of mine. And when I started hearing murmurings, and my director of education, Janet Ottersberg, made contact with you, Shashi, about all of this, we jumped at the opportunity, because as I said, my heart and soul has been very much in love with your beautiful culture, community, and country, that it's just devastating to watch this sort of, I think a mass extinction is maybe a harsh set of words, but I'm very concerned that is what we're witnessing.
We never knew about your connection with India.
You didn't. Oh,
so good. I asked it. Very, very interesting to see your approach. And maybe this 30-minute doesn't do justice. We will have, in the subsequent program, we are going to call you for 1 full hour to understand the metabolic link to cancer. Yeah. Because we always think it is something genetic, it is associated with something. We really don't realize the link of insulin and blood sugar to it.
Exactly. And so that's the bridge in the future for sure.
and as you rightly say, the incidence of diabetes is raging here in India. You must have already read some of the reports online that more than 101 million are having diabetes, 136 million pre-diabetes, 36% of the population may be having hypertension, 1 in 5 having PCOS.
Wow.
Obesity, childhood obesity, central obesity is the key here. We may be lean, we may not have high BMI.
Right.
But central obesity is seen. The classical definition of metabolic syndrome is seen in Indian people. Raised triglyceride, low HDL, raised blood sugar, slightly raised blood pressure, and central obesity. Classic. So this metabolic syndrome, the entire concept fits really into India.
Yeah. Yes. And you are all leading the charge to change that.
Yeah, that's what we are doing, like one at a time. One patient at a time, one client at a time. And Anup will also say what he is doing to battle this raging metabolic disorder. Yeah, Anup.
We have been basically, as you said, Indian diet is pretty carb loaded. And so the whole idea of launching DLife.in around 9 years back was to slowly get people educated on what low carb is. And once that has happened, then we focused on, creating an army of low carb professionals.
Perfect.
So that's it. And as you said, you've got 20 years of, Indian association, more or less. So I would request you to, what would be your message to India on this first, on the occasion of this first low carb or metabolic health conference?
I think I've alluded to it a little bit in our discussion this morning or this evening for you, and we have to get away from the dogma of our culture, and we have to look at this data, which, as I alluded to, was just because this is the way you, your parents and your grandparents, your great-grandparents, your great-great-grandparents have eaten for millennia at this point, that is no longer serving you. And as our bodies are unable to metabolically adapt to the changes we've made to our food sources and to the environment around us, we have to adapt to overcome those modern additions that have really bastardized our endocrine system. And so we have to be willing to let go of some of the ideologies that came at a right time and place, but is no longer the right time and place. And so my ask is that folks are willing to be emotionally and intellectually flexible as they face sort of the harsh realities of the soil that we had come from for many, 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 many moons is now the soil that's making us sick. And so that would be my hope, is that folks are willing to look at the data to help them overcome some of the dogma.
Very nice. So we will keep collaborating.
Please.
Is what I can say, Nasha, that we will keep collaborating. Collaboration between Metabolic Health Day, Nasha Winters, maybe Metabolic Health India, Metabolic Health Conference with D-Life. So we will keep collaborating. We will keep planning some activities so that your message also reaches India, and our message also reaches globally, because the Indian diaspora, the people who are abroad, they follow a similar pattern, and they suffer similar consequences. It is not that someone who has gone abroad, they change. They don't change. We as a culture are addicted to grains. That is one aspect. And the influx of modern processed food has really, this is creating a mess in children and the younger generation, is what I can say. So, and thank you for posting our video on this event. That is where me, Anup, and Ira Sahai, our media head, we had made this video especially for Metabolic Health Day, so that people across the world knows about this conference, because this conference is not only for India. It is a global thing. It is out there in YouTube. People can just log in and see, and recording is going to be available. And this is the inaugural session, and we are going to have much more interesting events in the coming times.
I love it. And I was telling Posh in the breakout room that I will be in India potentially twice this year, at least once, either in March or November, and potentially twice. And so I definitely want to keep these collaborations going, because the Metabolic Terrain Institute of Health is committed to global metabolic health. And even though we are, because of my own life experience, seem very cancer centric, at the end of the day, as I mentioned in the beginning, it's all metabolic centric. So we're here to help. We're here to support you. We are willing and very happy to accept all of your support as well. And I'm honored for this opportunity, Shashi and Anup. Thank you so much.
Thank you, Nasha. If you come to India, please message us. So depending on where you land up, there will be some one of us in some state.
I will take advantage. And that is the one thing I tell you, I have had the most amazing hospitality and support in your beautiful country. So it's an honor, and it will be an honor to return. Thank you.
Thank you. Thank you. Thank you, Nasha. Thank you.
You're welcome.